how are you today?
Yeah, I'm fine.
My name's Winnie. I'm your pharmacy today. So how can I call you?
You can call me Eric.
Area.
Yeah, Eric.
Is there anything I can help you today?
I want to find this medicine. I got this from TV advertisement.
Oh, so the TV tell you to use it. What kind of problem do you have?
Oh, I get some itching, you see?
Oh,
There are some the viscous and the scaling just between in the beach and the toe.
How do they disturb you?
Yeah, it's what?
How do they disturb you? Do you feel itchy or hurt?
Or just itching only?
Just itchy.
Yeah, so in the foot. It's the legs when I scratch the vessel.
Oh, so because it's itchy, you scrap it, right?
Yeah.
So, where did you get this ointment?
From TV.
From TV.
Yeah.
Oh, okay. So, because this kind of ointment is probably for the athlete's foot, and because we're not really sure if your foot is athlete's foot, if it may be infected by the fungus or by the virus or the bacteria. So if we're not really what is the source of infection is, we do not advise to use the ointment, especially if you're not sure where it is from.
So that's why I just got here and asked it, and just give me some opinion about that.
Yeah, so how do you feel after you're using it? How do you feel?
I didn't use it. I didn't.
Not yet. Oh,
not
that's
yet.
really good. That's really good. Okay, for my sincerely advice for you, I will advise you to see a doctor, and he will have a very fine examination for you, and maybe he will take some fluid from your foot, and they will send it to the hospital, and maybe they can culture and then check if it's infected by anything, probably. So, does it happen before?
Yeah, during my military life a few years ago.
Very long time ago. Right?
Yeah, it's happened to me during my military life. But during that time, the doctor has given this medicine all medicine for me. But still have some side effect.
Side effect? What kind of side effect do you have?
Just a long time ago, I just forgot it.
Okay.
So that's why I see it's got trying to explain to me this medicine is good or not for me.
But because we are not really sure about what the disease is, so maybe see a doctor now is a good advice for you. But do you have any kind of allergy history before?
Oh, no.
Okay, that's good. And because you are very itchy, you want to provide this kind of situation now. For my advice for you, I would suggest you don't use the ointment that you're not sure for, and maybe you can put some ice on your foot, or how's your lifestyle?
My lifestyle?
Yeah, what kind of food do you like to eat?
Food for the fresh vegetable, like
that's good, because some people like to eat a food that has really strong flavor and is really too intensive for our health. And because maybe your food is infected, so we're going to advise you to have at least 2 shoes to change every day. And don't put your socks to be washed with your other clothes, because if it's the bacteria, it will spread all around your body, and you scratch your foot and do it in the head, and it will become the bacteria will become in your head. That would be a really bad situation. And what's your job?
I'm the teacher.
I think it's impossible for you to wear slipper or sandals every day, right? Yeah, so maybe in a weekend you can put your shoes under the sun and prevent the bacteria to grow more and more, and at least to have 2 shoes. And do you know there's a kind of socks that separate your toes? Yeah, that would be better for you if the bacteria will be separated. So, for the most important, I will advise you is to go to see a doctor. Do you have a family doctor?
No.
Okay. It's okay, and maybe you can give me your telephone. I will advise some doctor for you. I know some very good doctor for that. And for most important, after you see a doctor, maybe he will give you some treatment. And please don't quit the treatment without the doctor's advice because it is infected and we're not sure if the treatment kills all the bacteria on your foot and maybe you don't feel itchy anymore. And if you stop it, otherwise we couldn't kill all of the bacteria on your foot. So it's very important to finish all the treatment.
So that's why I think this medicine is very popular from advertisement. So that's why people
I think that would be a reason why you buy it.
I see.
Yeah.
So that's why you advise me to see the doctor first.
Maybe you can take this medicine to a doctor to ask him if he would advise you to use it. But most of the medicine over the counter is only for emergency.
For emergency,
Yeah, for emergency, maybe because somebody has a really important meeting in the afternoon, and in the noon they feel very itchy, so they brought the OTC medicine to release the itchy. But most of the OTC drug is not for the long-term using, so it's really important to check it with your doctor and pharmacist. So after I talk for this much, how many things do you remember?
So that's why you try advise me not to use the medicine and then you try to see your doctor. But I'm still asking the question is why the itch is happen. The itch is happen. No, I mean the itch. The itching it happened. Why? Why it happened?
I think for my guessing, it will probably be infected, but what infected we're not really sure, so we will send the fluid to a lab after you go to see a doctor. Maybe he will have an examination, maybe he will send the fluid to a lab, they will culture it and check what is it.
I see.
Yeah, that's the most reason you want to know, right? Yeah, and remember, after you go home, the most important thing is, after you go home, don't put your socks washed with other clothes.
I see.
Yeah, and do you have any family live with you?
Of course, I live with the family.
Yeah, don't share the shoes with any kind of people because it may have bacteria. Okay. Yeah, so that's the thing I would like to say.
But what's happened is with my foot, how to prevent it in the future?
Prevent it?
Yeah,
I think that the most important thing is that you should stay a healthy life and eat the fresh food like yourself and don't eat too intensive food and keep the dry. Yeah, that's the most. Keep the food dry and to prevent infection become more seriously in the future. So that's the thing I said. So because I think I say a lot, it's hard for you to remember everything. So we have the brochure about infection on foot, and actually for you, this is for you. And after you go home, you can read it, have more information about the acid foot and the infection. Yeah, so that's all the counseling today. Do you have any kind of question for me?
Thank you for your advice.
Yeah, okay. Hope you have a nice day.
Okay, thank you very much.
Thank you.
Thank you.